So now an important ground report. It was being said consistently by the government and even by the Election Commission that the election-bound states are not reporting high numbers and therefore we can go ahead with polls. But could it also be because the testing in election states has also come down? We compared the election states, the non-election states and the testing that is being done here. This special report by my colleague Sneha Murdani.
Polls amidst Omicron. That is the biggest challenge before India today, as India's compulsions as a democracy force 5 states in the country to go to elections, albeit with strict protocol. But case count has gone up across India, and poll-bound states of UP, Punjab, Uttarakhand, Goa and Manipur are no exception. In Punjab, active cases jumped 12-fold in just 7 days, from 1,369 on the 2nd of January to 16,343 on the 9th of January. During the same period, the number of patients on oxygen support jumped from 33 to 254. There are 10 patients on ventilator now, as against just 1 a week ago. Test positivity rate in the state has also gone up to 12.6%, indicating that infection is quite widespread. Notably, the proportion of eligible population getting both doses of the vaccine in Punjab is one of the lowest in the country.
Another cause of worry is the higher number of patients who have been put on the oxygen support. According to an estimate, 264% rise has worried the state as more patients are being put on the oxygen support.
In Goa, the test positivity rate is at an alarming 25%. However, since vaccination coverage in the state is much higher than the national average, hospitalization remains quite low. Goa has the highest proportion of fully vaccinated adults, 96% among the 5 poll-bound states. And in UP, where political temperatures are soaring high, the positivity rate stands at 3.5%. What is worrying, however, is that active cases in the state have jumped over 15 times, from 1,725 on the 2nd of January to 25,974 on the 9th of January. Another concern is that the proportion of fully vaccinated adult population is only 53%.
What we have seen in Uttar Pradesh, that the doubling time of the COVID infection is very high. The test positivity rate, which was in Uttar Pradesh, it was 0.1%, and 0.1% has become 1.8%. Last year it was 18 times jump was in 30 days, and this time 18 times jump is only in 7 days.
In the midst of a sudden spike in COVID cases ahead of a hectic election season, the question that begs our attention is the trajectory the pandemic is likely to follow, with events such as rallies and roadshows.
India, a country that lacks social distancing, has repeatedly failed to follow the science on masks and ventilation, and we don't even have adequate testing and sequencing infrastructure. These elections are just going to be more super spreader events across these states, creating more infection, more disease and more mortality.
But some public health experts say that essentials can't be postponed forever because of the pandemic. And in fact, the government must now work with public health experts and epidemiologists to understand how can they really work around the pandemic to ensure that life in general does not come to a standstill because infections are surging.
It has been 2 years into the pandemic, and no one can be certain that what will be the future course of pandemic. In this backdrop, it's important that we continue with the essential activities of life, be it a social, economic, or even democratic process such as elections. We really do not know when and what situation would unfold. In that backdrop, it's important that elections are planned on the time.
The key will be how well social distancing norms are enforced. If the Election Commission is unable to ensure COVID-appropriate behavior in the campaign, the polls run the risk of becoming super spreaders. With inputs from Abhishek Mishra in Lucknow and Manjeet Saigal in Chandigarh and Samrat Sharma in Delhi, Sneha Murdani for India Today.